We all live in a yellow submarine, a yellow submarine, a yellow submarine. We all live in a... Oh, ha, you caught me in the middle of my song. I wasn't able to do that a while ago. You see, I kept getting infections all the time. It was tough trying to sing, not to mention talking or eating. I tell you, when I walk away from a pizza, there's something wrong. Well, my mom took me to the pediatrician, and they gave me some medicine to stop the infection. And at first it worked, but a couple of weeks later, I had another sore throat. And a few months back, I got really sick. As it turns out, I had a bad case of laryngitis. So my pediatrician recommended a specialist called a pediatric otolaryngologist. That's a mouthful. Anyways, these guys are ear, nose, and throat specialists. And it turns out all I needed was a simple surgery to clear things up for good. Alright, I admit it. When I first heard the word surgery, I was a little scared. But you know, it was really no big deal. Oh, you're seeing those docs. You need surgery too? That's cool. Don't worry. These guys are good. But you know, it might help if you do what I did. Just find out everything you can about the surgery. Then it's not as scary. Tell you what, let's crank up my computer. I have this cool website where you can find out anything you need to know about the human body. Okay, got the computer fired up. Let's get cranking. First, let's do a little search on the throat and see what's up with that.
Welcome to BodyLink, your online human anatomy information center. I'm Cindy, your interactive guide. Please type in your name and state your question.
Okay, my name is Eddie, and my question is, how do I get one of those monster record deals? You know, so I never have to get a real job.
Sorry, Eddie, that information is not in my database. Why don't you ask about something I'm familiar with, like the human body?
Yeah, sorry Cindy, I was just goofing with you. So what can you tell us about throats and infections and stuff?
As you probably know, the throat is a pretty important place. We use it for breathing, drinking, eating, and talking. Can you imagine not being able to talk, swallow, or breathe?
Yeah, that's exactly how I felt last time I had tonsillitis.
You know, Eddie, instead of talking to a computer, why not go right to the experts? I'll give you a direct online link to your pediatric ear, nose, and throat doctors. They can tell you everything you need to know about the throat, including common problems and how they're cured.
That'll be cool. She's going to connect us to the docs. These are the guys who did my surgery a while back. They're specialists, and they really know what they're doing.
Okay, Eddie, you're ready to go. All you have to do is type in the doctor's name, and you'll be connected to a live link at their location. They're expecting you, so I'll go ahead and hook you up with Dr. Orabello.
Hey Eddie, what's up?
My friends and I are trying to find out about the throat and different throat infections and stuff. But first, I understand you doctors are called otolaryngologists? What does that mean?
An otolaryngologist is a specialist who's primarily concerned with the medical and surgical treatment of the ears, nose, and throat problems.
So you're a head neck man, eh?
Oh, I guess you could say that. Now let's talk a little about the throat. In our practice, we see lots of kids with throat infections. Probably the most common is tonsillitis.
Oh, yeah, I know a lot of kids in school get tonsillitis. And when I had it, I remember my throat really hurt. But I still don't know what causes it.
To really understand tonsillitis, you first have to understand the tonsils and what they do. The tonsils are basically lymph nodes in the back of the mouth. Most people think you only have one set, but you really have 3 sets. The tonsils we normally treat for tonsillitis are called the palatine tonsils. These are the tonsils you can see in the back of your mouth. Another tonsil, known as the lingual tonsil, is located at the base of the tongue. And a third set of tonsils, known as the adenoid, is located behind the nose, above the throat. Tonsils normally help filter out bacteria and other microorganisms to process infection in the body. Sometimes they're so overwhelmed by bacterial or viral infection that they become swollen and inflamed, causing tonsillitis. Tonsillitis is extremely common, particularly in children. The infection might also involve the throat and surrounding areas, causing pharyngitis.
Is there any way to keep from getting tonsillitis?
About all you can do is try to avoid people who you know have tonsillitis or sore throats.
How do you know when you have tonsillitis?
Some of the symptoms we see are a persistent sore throat, one that lasts longer than 48 hours, difficulty swallowing, headaches, fever, chills, tenderness of the jaw and throat, voice changes, or sometimes even ear pain.
That's how I felt. Lousy.
Feeling yucky is normal for tonsillitis. When the pediatrician sees you in their office, they'll look for enlarged, visible tonsils. They're usually red and may have white spots. The lymph nodes of the jaw and neck could also be swollen and tender to the touch. Your doctor may get a small sample from the inside of your throat and test it for bacterial infection. That's called a culture. A test may also be made for streptococcus bacteria because it's the most common and most dangerous form of tonsillitis. Say, Eddie, I'm sorry. I'd like to talk more, but I've got to go to see another patient. Try hooking up with Dr. Andrews. He's in surgery today, but you might catch him during a break. He'll tell you how we cure tonsillitis for good.
Thanks. I'll give him a try. That's pretty interesting. I never knew that there was more than one set of tonsils. Well, let's type in Dr. Andrews' name and see if we can catch him.
Well, that about wraps it up. Hey, I'm getting a message on my computer. Hey, Eddie, I heard you'd be getting a call from you.
That's right, Doc. I was just talking to Dr. Orabello about tonsils, but he had to run. Mind if I ask you a few questions?
No, I was just finishing up. What's on your mind?
Well, we talked about tonsils and where they're located, and I know that tonsillitis is an infected tonsil, but I don't know how tonsillitis is cured.
That's a good question. If the cause of tonsillitis is bacteria, such as strep, we first try the antibiotics to knock out the infection. We also recommend plenty of rest and fluids to get you back on your feet. But if the antibiotics aren't effective, or you keep having repeated infections, you may need surgery to remove those bad boys.
That would be a tonsillectomy, right?
Correctamundo, Eddie. A tonsillectomy is a fairly simple and straightforward procedure, but like any surgery, it has risk, and it's not the easiest surgery to recover from. That's why we want to be sure the operation is absolutely necessary before we do anything. There are established guidelines for surgery. For instance, we look to see if tonsillitis attacks are so frequent or severe they affect a child's general health. That includes infections, trouble swallowing, difficulty breathing, missing school, and going to the doctor a lot for medicine. Those are all good reasons to remove the tonsils. We check to see if you've had at least 4 episodes of tonsillitis in a year, or you might have had a month-long infection even while on antibiotics. Maybe you have difficulty breathing while sleeping, and you sound like Darth Vader when you're awake. You might be having trouble swallowing, or maybe you have just one tonsil that's getting really big fast. These are more good reasons for a tonsillectomy.
You mentioned risks.
All surgeries, no matter how minor, carry some risk. That's why we have a specific set of rules and procedures that must be followed before any operation. For instance, we want to be sure you don't have any adverse reactions or allergies to medicines, or any history of bleeding disorder. As long as the procedures are followed, and with today's modern surgical techniques, a tonsillectomy is a very safe operation.
Is the surgery painful?
Well, do you remember when you had your surgery?
I remember it was sore going in, and it was still sore after the surgery. I guess it felt about the same, but I got a whole lot of ice cream, and that made things better. And I read some comic books too.
The surgery is really not too bad. In your case, you were tossing down pasta and singing along with the radio a week or so after the surgery. But all people heal differently. Some a little quicker, some a little slower. Overall, most kids feel like they have a bad sore throat for 7 to 10 days after surgery. That's about it. Then they really start feeling good.
I guess that makes sense. But one of my friends told me his dad had a tonsillectomy when he was a kid, and there was a lot of bleeding. Could that be true?
It's very possible. I know it was back when I had my tonsils out. That's because the throat is a very vascular area. That means there's lots of blood vessels going to the tonsils. So if there's a cut, even a small one, there can be a lot of bleeding. There's a lot of new technology that we can call upon to control bleeding. One of the things we use is a tool that cauterizes the blood vessels where we take out the tonsils. Cauterizing keeps bleeding to an absolute minimum.
What's cauterizing?
We use electrical energy from a small surgical tool that looks like a pencil. We use that to fuse the blood vessels shut. This keeps them from bleeding.
Does it hurt?
You won't feel a thing. That's because we give you some special sleepy air that lets you fall asleep before the operation. When you wake up, the surgery's done, and you're on your way to feeling better.
I'm liking that.
Did anybody talk to you about the adenoids?
No. Aren't they robot invaders from another planet?
No, Eddie, that's androids. But if you're talking about throats, you really need to know about adenoids.
Paging Dr. Andrews. Dr. Andrews to OR2.
Sorry, that's for me, Eddie. Sounds like our break's over. If I don't get back to surgery soon, they're going to send out a search party.
So, you spoke with Dr. Andrews?
Yeah, he just got called away. But right before he left, he said we should know something about adenoids.
Adenoids, huh? Okay, give me a second. I'll access our database.
Adenoids. I still think they got that from Star Trek.
Not quite. You remember that there are 3 sets of tonsils, right?
Yeah.
Well, the adenoids are one of those sets. They are also known as the pharyngeal tonsils. They are located along the back wall of the uppermost part of the throat, behind the nose. This area is called the nasopharynx.
So, what do the adenoids do?
Well, according to my research, tonsils or adenoids do pretty much the same thing as any lymph node. Some researchers have shown that tonsils play a role in making antibodies, especially early in life. And some studies indicate tonsils even have disease-killing cells called natural killer cells.
So, if they're so good at fighting disease, why do they get infected?
That's a good question, and scientists are trying to find the answer. We do know that adenoids often become very infected and inflamed. That's why they have to be removed. But you should really talk to a doctor about that. Oh, okay, great. I just received word that Dr. Andrews is free again. Try and reach him now at his office.
Let's just type in Dr. A's address and see if we can get him.
Hey, Eddie, sorry about the interruption. So where were we?
Talking about adenoid problems.
Oh, right. Well, when your adenoid becomes infected, it can make you really sick. So many of our patients need a procedure called an adenoidectomy. That's when we take out your adenoid to help you feel better. A lot of times we find it's best to remove both the adenoid and the palatine tonsils at the same time. Remember, the palatine tonsils are the ones that are usually associated with tonsillitis. But adenoiditis isn't the only reason for removing the adenoid. If a patient constantly breathes through their mouth, or if they seem to catch every cold within 100 miles, or if they get a lot of ear infections, we might need to take out their adenoid.
But what do adenoids have to do with ear infections?
The adenoid sits in the back of the nose and can either block or cause infection at the end of the tube that lets you pop your ears. So if you have a lot of ear infections and they seem to be associated with a stuffy or runny nose, we know from experience that your adenoid is involved.
So Doc, after a kid has surgery, how soon can he go home?
First, the child has to be completely awake. It's also important that they're able to breathe easily, cough, and swallow. Most kids go home a few hours later. Surgery? Oh, that reminds me. I have a post-op evaluation in a few minutes. Have you talked to Dr. Cressman yet?
No, not yet.
Give him a buzz. He'll help you out.
Thanks, Doc. Wow, I think we're really learning a lot about throat problems. Although I still think adenoids sound like they come from outer space, let's see what Dr. Cressman's up to.
When would you like to see this patient again?
How about next week?
Look, there's someone on your screen.
Hey, Eddie, what can I do for you?
I've been talking to your partners about tonsillectomies and adenoidectomies, and I'd like to know a little bit about what it takes to get prepared for surgery.
No problem. You know, one of the best ways to get ready for surgery is to get in the right frame of mind. A good attitude starts with understanding all the facts regarding surgery and eliminating any unnecessary fears. Parents can do this by discussing the operation with their child. If kids understand the procedure, this often helps avoid problems.
That's what we're doing right now. We're finding out all the facts, so you don't have to be scared.
That's a great idea, Eddie. The more you know, the better you feel. Before surgery, you'll get a package of consent forms and information sheets regarding the procedure. It's important parents and guardians review this information carefully and follow instructions on the forms. If they need any help or have any questions, they should ask the doctor or someone on their staff. We're always available to help. Here are a few things that must be completed prior to surgery. We'll call this a pre-op checklist. If you have to cancel your procedure, contact the surgery scheduler immediately. Also contact the scheduler right away if there are any changes to your phone number or insurance policy prior to surgery. If the patient's been given a prescription for lab work, make sure it's completed 3 to 5 days before surgery. The patient can't have any recent vaccinations prior to surgery. If the patient develops RSV, pneumonia, bronchitis, or is exposed to chickenpox, contact your doctor's office immediately. A pre-admission nurse from the surgical facility or hospital will contact the patient's parents or guardian the day before the operation. This nurse will tell you when the patient must stop eating and drinking prior to surgery. Also, the patient can have any aspirin or ibuprofen for 2 weeks before the procedure. This information is very important, so be sure to follow the nurse's directions carefully. Finally, be sure to bring the history and physical form with you the day of surgery.
Wow, that's a lot of info.
You're right, but it's very important to understand and follow these directions carefully. Remember, if you have any questions, please call the staff at our office. They're always happy to help.
Is there anything else we need to know?
Just a few more things. As a precaution, parents should contact our office immediately if their child experiences nausea or vomiting that lasts longer than 24 hours after the procedure. You should also call if there's a persistent fever. After a tonsillectomy, there's a slight chance of bleeding 7 to 14 days after surgery. If this happens, gargle with ice water and call us immediately, be it night or a weekend. The chances of things happening are remote, but you can't be too careful when it comes to surgery.
You know it, especially when someone's an up-and-coming singing sensation like me.
Well, it's been nice talking to you. Give us a call if we can help.
Thanks, Doc. I will. I think we have all the info. We talked about throat problems and surgeries. I feel good about the docs. They took good care of me, and they'll take good care of you too. I should be coming in for my checkup real soon, so maybe I'll see you at the doc's office. So what are you waiting for? Get that surgery and start feeling better. Me? I've got some songs to learn. Catch you later. Oh yeah, be sure to tell the docs I said hi.